Hi everyone, I'm Anna Lahey, the founder of Vida Glow, and I'm here today with Dr Ewoma, who is a medical and cosmetic doctor. We are together to answer some of our community's questions on ingestibles versus injectables. So let's get started. It's a pleasure to be here. I'm so excited to finally be in London.
Likewise.
With you in person, not Zooming.
I know, or in the DMs, right?
I know.
So here's a question. Is collagen and Botox the same thing?
Well, when I first discovered marine collagen, I actually thought they were the same thing because collagen. But actually, no, they're completely different. So marine collagen or collagen supplement is a hydrolyzed peptide powder. And collagen is a natural occurring protein in our bodies that is responsible for the building blocks of our hair, skin, nails, teeth, tendons, joints. And we naturally lose collagen from about 2% a year from the age of 25. So using a really good quality collagen supplement helps to increase collagen levels and also stimulate fibroblast proliferations, which are the cells responsible for collagen production in the body. And it is an ingestible supplement as opposed to an injectable. So they do work completely differently. But some of the clinical results on collagen supplementations are really tangible in decreasing the appearance of fine lines and wrinkles, increasing skin plumpness and the structure of the skin. So did you want to explain what Botox is?
Yeah. So this is something that I find people really get confused about. Botox is actually derived from a bacteria, so it's the Clostridium botulinum bacteria, and the actual toxin is what we inject, and the toxin works on muscles, and no, they don't freeze muscles.
Really?
No.
See, I thought that they froze muscles. Okay.
Well, if you use enough,
Yeah, okay,
like
okay.
a lot,
Okay.
it will. If your practitioner, your doctor uses a sensible amount, it's not going to freeze your muscles. Instead, what it does is that it just really minimizes the movement of the muscles that you're trying to target, hence reducing the appearance of wrinkles and fine lines.
Okay. So one question, it's a bit off script, but I've always wanted to know this. Why, when people use Botox sometimes, or too much Botox, if they get too much put in, why do they get that shiny appearance?
Yeah, I kind of have this sort of table analogy to kind of explain the sort of relationship between the skin and the muscle that you're trying to treat. So imagine the table is like a muscle, and then the tablecloth is your skin. And Botox, as I said, works on the muscle or table itself. And so if you can minimize the movement of the tablecloth on top is going to remain sort of clean, smooth, and wrinkle-free. But if you really stop the movement of that table, i.e. the muscle, that tablecloth is going to look very tight, and then hence that shiny look.
And is that from oil production, excess oil production?
No, it's just, there's just no movement to the forehead.
Yeah, okay.
No movement even whatsoever to the forehead.
And how can someone avoid that if they're interested in getting Botox for the first time? Like, what do they say? I mean, that's usually, I think, one of my biggest fears with Botox is getting that shiny, frozen look.
It's a real fear with a lot of my patients when they first come and see me. But I think it really is down to the practitioner. It's really down to the practitioner's aesthetic. And if they prefer that frozen look or not. Many do. I don't. Because my sort of natural aesthetic is all about looking really natural and looking like you've made an effort, but not really.
Yeah.
So I like that more kind of natural result. So in order to achieve that, I just make sure that I use, I would say, more on the sort of lower end of normal of an amount of Botox. And that's why, you don't get that sort of shiny look.
Okay, so I have another two questions that I'm really interested in when it comes to Botox. And number one is preventative Botox a thing? And number two, is there a right age to start getting Botox? Is that a thing?
Yeah, I get those questions a lot. So from my point of view, and I emphasize that because I would say the medical community is quite divided on this point, but I'm very much an advocate for preventative Botox. I find that when you start at an appropriate age, i.e. from the age of 25, 30, again, depending on the person, when you start, at an appropriate age, it just means that the results that you get are a lot more meaningful and just a lot more sort of long-lasting. Okay.
Why is the medical community divided on that?
I feel like, again, we're divided because purely from an aesthetic point of view, and as weird as it sounds, some of us are very pro-injectables and some of us aren't,
Yeah.
although we administer them.
Yeah.
And again, some can be quite liberal with it, some not so much. So yeah, so I think it's down to those things and also just a personal preference.
Yeah.
In terms of there actually being any sort of medical research, I've personally not seen it in terms of which approach is better. But I find that personally this approach in clinic gets me the best results.
Sure. You mentioned Botox and fillers. So I want to ask you, Botox or fillers?
This is really hard. It's like picking babies, i.e. my baby. Do I have to pick one or can I say both?
Okay, well maybe, no, I won't make you pick one, that's not fair. I mean, I couldn't pick one of my, I could definitely pick one of my children, but I couldn't pick one of my dogs. So I get it. But what is the difference between them and why do you like both?
Yeah, so there's a real difference between Botox and filler, and this is why it's so hard to pick because they both do very different things. So Botox, as I said, works more so on the muscle, and that's going to be great for treating fine lines and wrinkles. And a kind of secondary effect is that it does sort of make the skin appear just more sort of glowy and healthier. Versus filler, that's made out of hyaluronic acid, and so filler is great for plumping the face, hydrating the face, and just adding kind of contours and volume. So very, very different injectable products. So another question, does collagen supplementation actually work?
Yes, it actually works. I'm really passionate about this. I think ingestible beauty as a category is still very much in its infancy. And so what that means is that although it's a beauty buzzword, there's still so much misinformation in the category as a whole. But in fact, the science is really clear. And what's exciting to me is when you start seeing independent studies being done on collagen supplementation that aren't brand-led. And we are beginning to see a lot of those now. The gold standard in clinical trials is what's called a double-blind placebo-controlled study. And that is where one group is receiving the collagen and another is receiving a placebo. And the results are really compelling in terms of the benefits in skin hydration, elasticity, firmness, the 50% reduction in the appearance of wrinkles and fine lines. So I think the science is really clear. And with an independent hospital that made a study on Vida Glow's marine collagen. People that have previously been sitting on the fence about whether or not this is pseudoscience, I feel are really getting off the fence and getting on the collagen bandwagon, which is really an exciting thing. I think the most important thing for looking into a collagen supplement is that it's hydrolyzed, is obviously very important. Where is it sourced from? And what is its molecular weight? I'm really passionate about educating people on molecular weight of collagen because collagen in its raw format has a 300,000 Dalton molecule weight, which is not going, it's a huge molecule. So in order to hydrolyze it to a really low weight, and Vida Glow's is as low as 2,000 Daltons, is really important for the bioavailability and the efficacy of the product. Because when you put collagen in your water and you drink it, it passes the lining of the stomach intact and it's pre-digested, which means that it's absorbed and distributed by the bloodstream. And the lower the molecule weight, the higher the absorption rate because it's traveling to that collagen matrix via tiny blood vessels. So the molecule weight is such an important thing to ask about and look into when choosing a collagen supplement.
Amazing. Okay, another question. Does vegan collagen exist?
Oh, great question. There has been a lot of progress made on lab-grown collagen, and this is something I'm particularly interested in. At the moment, to manufacture, there really isn't enough clinical trials or research done on the efficacy of the product. It's also very much in development stage, so it's a little bit of watch this space. I know that the amino acid profiles are still a work in progress, and we have looked at fermentation of plant-based amino acids. However, to manufacture is still extremely expensive. It'll be interesting what happens in these developments in the next 5 years or so, and it is something that I'm closely monitoring. At the moment, the best form of collagen supplementation still is from marine-based sources. Okay, here's one for you. So how long do the results last from Botox and fillers? Are they different? Are they things that accelerate the lasting process, for lack of a better word?
So it is very much a variable in the sense that it does depend on person to person, so i.e. what your natural metabolism is. But generally speaking, for Botox, it lasts about 3 to 4 months. And then with filler, depending on the sort of product used, i.e. whether it's a more firmer filler or more softer filler, it can last anywhere from 3 months to even 24 months.
Oh, wow, okay. You're exercising a lot. Like, are there variables in that sense that actually affect how long Botox or fillers will last?
Yeah, definitely. So I find that my patients who are super active, i.e. personal trainers, athletes, Botox just doesn't last as long. So where it should typically last about 3 to 4 months, instead it can even last just a month or 2.
Okay.
Okay, so can marine collagen help Botox and filler last longer?
Okay, so I think it's really important to note here that there are no clinical studies that point to any evidence of this. What is interesting is that Botox or fillers work to really negate the aging process and making you look, and because you look younger, you feel younger. Collagen also does that, but in a really holistic way. So the benefits of collagen supplementation for overall health of hair, skin and nails, and the very robust clinical evidence on the benefits on skin in particular, skin structure, skin firmness, increasing elasticity, and the density of fibroblasts which produce collagen in the skin, do have an effect of a more youthful looking appearance. And so they certainly can work hand in hand, but as we've explained, they work very differently. And I can't say that collagen will make Botox lasts longer because we have no evidence of that. If you're doing the two in tandem, I think the overall benefits will be improved, because if you are consistent with collagen supplementation, and I think it's really important to note that consistency is key, you will feel an overall improvement in the look of your skin, and that adds to the overall benefit of your beauty routine.
Okay, how quickly do you see results from collagen?
So clinical studies show that at 4 weeks or 30 days of collagen supplementation is really when you begin to see results. I say, from my experience as the founder of this brand for the last 9 years, is that I always say to everybody, if you are consistent with your collagen supplementation, as in you take it every day, don't dibble dabble, can't have one on Monday and one on Thursday, within 3 weeks, you're hooked. The tangible, visible results of collagen supplementation actually never fail to surprise me. The amount of feedback and the DMs that I get in, and the feedback that people write into our customer service team if they're consistent. And actually what's interesting is that people see different results. So a lot of people say the hardening of my nails, that, you know, it's borderline annoying. Like, I have one girlfriend who's like one a day, because otherwise I'm Cruella de Vil with my nails. They grow so fast. For me personally, and the inspiration behind starting Vida Glow was a dramatic decrease in my hair loss. So consistency is key, and if you are starting at 4 weeks, those benefits continue to improve going forward. And important to remember that this is designed as a daily consecutive supplement.
Really amazing results as well. So just like your friend, my nails grow extremely fast.
Is it annoying?
It's so annoying. It doesn't annoy my nail tech because it means that I see him basically every 2 weeks.
Yeah.
But it's a very expensive nail habit.
Yeah.
Thank you, Anna.
Okay, so one of the questions I have here is, I'm turning 50 this year. Is it too late for me to get Botox?
Okay. Well, it's not quite late. However, definitely if you started at, say, a younger age, that would allow you to see an even sort of greater, better benefit from Botox. But not all hope is lost. You will see great results all the same. Definitely what I would encourage alongside that is, of course, make sure you supplement with collagen, look after your internal health, making sure you're having a great balanced diet, and then, of course, having great skincare. I absolutely adore retinoids. So it's a topical ingredient that's amazing for treating and preventing fine lines and wrinkles. So as long as you're doing all of those things, so again, that holistic approach to skincare, you'll get amazing results. What time is the best time of day to take a collagen supplement?
Okay, so the data isn't very clear on this. There is, in short, whatever time is more convenient for you. There isn't evidence to show that taking it in the morning or taking it at night has better results, but there is substantial evidence to show that taking it consistently every day has incredible results. Okay, so one of the questions I have is, I'm 25 and I want to start doing something to help prevent wrinkles. Ooh. Should I try collagen or Botox?
Yeah. Oh, such a tough question. Well, first of all, it's great that you're thinking about your anti-aging routine because, as many of you may know, collagen levels do start to decrease from the age of 25. So 25 is a great age to start thinking about this. With all things, I would say, start from the least invasive thing first. So definitely start with collagen supplementation. Make sure that you have a great skincare routine, using lots of retinoids, sunscreen, antioxidants in your skincare routine. And then if you feel that after maybe a few years of using that, you're still not getting the result that you want, then you can implement Botox.
Great answer.
Is Ingestible Beauty or Injectables pregnancy safe?
So, although many of our customers have used Ingestible Beauty products during their pregnancy and whilst breastfeeding, clinical studies have only been done on non-pregnant women. However, this is something that I'm particularly passionate about, and there is a lot going on in this space behind the scenes at Vida Glow at the moment because I've obviously had 3 children, and I personally took collagen in all 3 of my pregnancies and whilst breastfeeding. So our current advice is to check with your healthcare professional, take in the ingredients list or the product for them to read, and so then they can advise what is best for you. So for me personally, I found that taking collagen during pregnancies and in particular in postpartum really helped with the amount of hair that I was losing in whilst nursing. And what about you, Dr. Ewoma? What about injectables?
Yeah, so please don't do injectables whilst you're pregnant. Of course, make sure that you speak to your obstetrician. But yeah, injectables is not something that I recommend for pregnancy. It's not been tested, and even kind of from a logical medical point of view, it just wouldn't be safe.
Okay, and is that because it trickles into the bloodstream, the bacteria or the toxins of Botox?
Yeah, so particularly Botox, you do get some absorption into the bloodstream, albeit very minute. But of course, when you have a growing human inside of you, you don't want to take any sort of risk whatsoever because at the end of the day, it is a toxin, so better safe than sorry.
Okay. Okay, and that's it. Thank you so much, Dr. Ewoma, for joining me today to cover all things injectables versus ingestibles. I feel like I have learnt so much myself. Thank you, everyone, for tuning in.